Good afternoon, everyone, and thank you so much for joining us. This is Alicia Smith. I'm the Director of Chronic Disease Prevention at ASCO. We are very happy to have you all joining us today as we open up a series of mini virtual workshops presented by the Tobacco Control Network. The workshops are going to be related to workforce development and tobacco retail marketing. This is the first session of 3. Our first session will provide a platform for discussing tobacco control laws and the importance of monitoring compliance among retailers. We are so overjoyed to be joined today by Ms. LaTanisha Wright, who will overview the role of trade marketing managers, contract requirements, predatory demographic retail targeting, and more. She has been working in her capacity for quite some time, and I will read a little bit of her bio. Following today's virtual workshop, you will receive a follow-up email that will have more details related to her presentation, and her contact information will also be included if you all want to get in touch later. She's the CEO and public speaker and author who is both nationally and internationally known, a tobacco control and anti-bullying advocate. In 3 years, she earned a Bachelor of Science in Mathematics from Spelman College in Atlanta, Georgia. She obtained an outstanding academic record that included participation in programs offered by NASA and the NAACP. She was a consistent member of the Honor Roll and the Beans List. So we are welcomed here today by having her participate and provide a wonderful presentation. LaTanisha, I will turn it over to you.
Good afternoon. Ms. Smith, thank you so much for the introduction as well as the opportunity to participate in this webinar series. The goal of this session is to provide an overview of big tobacco retail marketing as well as the importance of creating and conducting comprehensive retail assessments in order to reduce disparities in access to tobacco. As Ms. Smith mentioned, you will receive a link to some of the presentation materials, including several handouts. The Follow the Signs fact sheet provides details about Follow the Signs, our mission, and some of our products and services. There's information about my memoir, which chronicles my experiences working for and against the tobacco industry. And there's also info about the global investigative film, Big Tobacco Young Targets, which exposes tobacco industry youth targeting. The tobacco industry marketing overview handout is a few pages, and it provides the key points to this presentation, as well as a few strategies to address tobacco retail marketing. There's also a Follow the Signs evaluation form. If you complete this form and return it to the email on the bottom of the form before 5 p.m. Eastern Standard Time tomorrow, then we'll offer a discount on future services. And you can see the bottom of the form for details. So let's talk about the tobacco industry. According to the CDC, there are over 34 million adult smokers in the United States. More than 16 million live with a smoking-related disease. Smoking is the leading cause of preventable morbidity and mortality, and it harms nearly every organ in the human body. The tobacco industry, they lose about 4,800 customers per day. Of that amount, 3,500 quit, and you know what happens to the rest. They die. The tobacco industry is the only industry known to kill half of its regular consumers. Now, over the years, they have operated with fraudulent and unlawful business practices that have resulted in more than 7 million deaths annually across the globe. They have suppressed research. They have created doubt. They have lied about the hazards of tobacco. They have destroyed documents that were ordered to be released to the public. They have committed fraud and conspiracy to deliberately deceive the American public with poisonous and unnecessarily dangerous products. The RICO Act, the same act used to prosecute the mafia and all others actively engaged in organized crimes back in the 70s, was used in 1999 to prosecute the tobacco industry. This industry is powerful, and they are corrupt. And it's certainly not an industry that you want to work for. In 2001, I was drowning in college debt. I was looking for a job. I attended a NAACP job fair for sales and marketing in Dallas, Texas. Now, during that time, there were 4 big tobacco companies: Philip Morris, R.J. Reynolds, Lorillard, and Brown & Williamson, and they were all present at this job fair. I had no desire to work for or speak with the tobacco industry, but just as I was leaving, a Brown & Williamson recruiter approached me. He told me that the company could offer me a $20,000 salary increase from what I had previously earned as a high school math teacher, a $5,500 signing bonus, quarterly bonuses ranging between $1,500 and $3,000, guaranteed salary increases every 6 months. He offered 2 new company cars with unlimited personal and business use. If I wanted to drive the vehicle from coast to coast, I could do that. On top of that, they offered me a credit card to cover the vehicle's expenses, including gasoline, so they cover my gasoline. An additional credit card was offered to cover all other business expenses, including my personal cell phone and home internet. The recruiter offered me a fully funded pension plan, generous stock options, a 100% tuition reimbursement program, fabulous medical benefits, daycare assistance had I had children, a more than sufficient amount of paid vacation and sick leave, and the cherry on top with a flexible schedule. Now, these were entry-level management benefits. I was 21 years old, and I took the bait. I hated my job, though. I hated my job so much that I couldn't sleep at night. I went to the doctor. The doctor prescribed Ambien, and you know what? It didn't help my sleep situation at all. It actually made my furniture dance across my bedroom, grow lips, and talk to me all night long. In the morning, I threw the Ambien in the trash, went to work, hated my job even more, and it was a deep hatred. And I wasn't the only big tobacco employee that felt that way. Others dealt with it by self-medicating with drugs and alcohol. Some even committed suicide. And there was a point where I, too, was suicidal. I was depressed. I was going through it. I was tired and sleepy. But as young people say today, I was woke, and I stayed woke. I began working against big tobacco several months before I resigned, and that's how I dealt with the trauma of working for the tobacco industry that kills nearly 500,000 Americans each year. Now, I worked as a marketing executive for 3 years, both in Atlanta and Detroit. And I can tell you from personal experiences that the tobacco industry marketing strategies are predatory, and they create disparities in access to tobacco at retail. Now, like most commercial marketing firms, the tobacco industry manipulates marketing in order to gain brand recognition and increase sales. Tobacco marketing stimulates unplanned purchases, it plays a major role in brand selection, and it discourages quit attempts and abstinence among current and former tobacco users. It increases youth access to tobacco. Now, marketing in general is everything an industry does to influence the sale, use, and or purchase of a product. It consists of several different components, including research, customer service, sales strategy. But there's also the 4 Ps, which I'm going to focus on during this presentation, as well as the next 2 sessions on March 20th and 26th. Now, the 4 Ps, the first is product, which includes ingredients, nicotine, menthol, flavor, and packaging. There's present/placement, which are your ads, displays, and pack design, and price and promotion, which are your discounts, buy-downs, coupons, sweepstakes, incentive programs, price protection, etc. Now, there are hundreds of tobacco companies operating in the United States. The big 3, Philip Morris, R.J. Reynolds, and ITG, do the most damage at retail, hands down. The big 3 actually refer to the non-big 3, the small tobacco companies, as the bottom feeders. So the big 3 know that they're doing the most damage out there, and it's important that we understand who they are and what they're doing. Now, Philip Morris ranks number 1, and R.J. Reynolds ranks number 2. Brown & Williamson, the company I once worked for, merged with R.J. Reynolds in 2004, and Philip Morris and Lorillard, R.J. Reynolds and Lorillard merged in 2014, allowing ITG to step up into the big tobacco game. Now, the big 3 have multiple brands in their brand portfolio, and they also have a variety of tobacco products. So they have cigarettes, STPs, your smokeless tobacco products, LCCs, little cigars and cigarillos, and Ns, which are your electronic nicotine delivery devices. So multiple brands, different brand styles, different types of tobacco products. Now, next to gasoline, tobacco is the most profitable product at retail. Retailers must discount and advertise tobacco in order to increase profits in all other product categories. In other words, exterior price communication for tobacco attracts people into stores to not only purchase tobacco, but sweet and salty snacks, their fountain drinks, lottery tickets, alcoholic beverages, and so forth. Now, tobacco sales increase as tobacco discounting and advertising increases. Now, retailers don't have the financial ability to self-fund ongoing tobacco discounts or constantly refresh tobacco advertising, but the tobacco industry does. Now, the trade marketing department is the most critical department for each big tobacco company. It ensures the visibility and availability of tobacco products at retail. It convinces non-tobacco users to start using and current tobacco users to continue. Now, TMs, or your trade marketing / territory managers, are responsible for territories that can sometimes consist of well over 330 stores. Their job is to build relationships with retailers that sell commercially manufactured tobacco at gas convenience, liquor, drugs, your grocery stores, supermarkets, mass merchandisers, and or wholesalers. The purpose of building the relationship is simply to obtain, execute, maintain, and monitor as many contracts as possible in their territory. Now, currently, the big three are the only tobacco companies offering major contract options to retailers. The majority of U.S. tobacco retailers are contracted with at least one big three. They receive free advertising and ongoing financial incentive programs. Now, contracts require three things: distribution, meaning retailers must purchase leading brands and brand styles that have them available for sale. There is visible distribution, meaning leading products must be visible to customers. And last, there is price communication, meaning the prices and promotions of leading brands must be visible to customers. Now, these three requirements must be met at all times, 24 hours a day, 7 days a week, 365 days out of the year. Now, the visible distribution and price communication requirements can be achieved with a small display, a small tobacco display, and a small sign. However, tobacco companies bully retailers into believing that they must have multiple signs and huge displays in order to qualify for a contract, and that is just not the case. Now, the contracts give the tobacco industry the authority to control and manipulate marketing, in particular the 4 Ps. Tobacco sales in contracted stores, they often double or triple, which translates into increased nicotine addiction, increased youth access to tobacco, and increased smoking-related disease and disability. Contract noncompliance often results in the suspension and or termination of the retailer's contract and financial benefits. Now, your TMs visit contracted stores at least once per month to ensure all contract elements are in place. They monitor the 4 Ps each store visit, and they visit non-contracted stores at least once per quarter to offer occasional advertising and to build a relationship with the retailer in order to get a contract. Their goal is to achieve 100% contract penetration. Now, my Detroit territory with Brown & Williamson was a few miles west of downtown Detroit. It consisted of 186 stores that served an estimated 325,000 people. Of that 325,000 people, 85,000 were smokers. They purchased, again, 85,000 smokers purchased at least 250,000 packs of cigarettes per week. Now, it costs the tobacco industry 1 penny to make a cigarette and therefore 20 cents or so to make a pack of cigarettes. So you can understand how each territory out there produces multi-million-dollar profits in tobacco sales each year for the tobacco industry. Now, financially, tobacco contracts benefit retailers, but nothing like how it benefits the tobacco industry. You know, the tobacco industry's global tobacco income is $16 million per second. $16 million per second. And of that amount, $1 million per hour is spent to market tobacco in the United States. So tobacco industry is getting filthy rich off of selling tobacco. TMs your retailers receive financial benefit. But you know what? They receive money, but they also have a very dysfunctional relationship with the tobacco industry, and that's often one of their greatest burdens. When TMs build relationships with retailers, when they go into the store, they're very kind, they're generous. Hey, retailer, what can I do for you today? But once that contract is signed, the TMs are trained to become very aggressive and pushy. So they get the contract signed, they leave the store, they visit the store the next month, and then their attitude changes. They're aggressive, they're pushy, they take tight control of the tobacco category and the contracted store, which often leaves retailers feeling intimidated, and it makes them afraid to dispute excessive or unwanted tobacco ads, displays and products, and even promotions in their own stores. Now, the greatest single predictor of tobacco use is low socioeconomic status. Where you live, where you work, your education, your income, these are all social determinants that impact smoking and smoking prevalence. Now, archived tobacco documents show proof of specific demographic targeting. Back in the day, the tobacco industry would flat out say that they target blacks or whites, Hispanic, the poor, they target young people with various tobacco marketing campaigns. Now, in 1993, R.J. Reynolds flat out said they don't smoke tobacco, but they reserve the right to sell it to the young, the poor, the black, and the stupid. Now, this is just flat out predatory. These days, instead of saying black or white or Hispanic or poor, the tobacco industry will use terms like focus, non-focus, and focus on the fringe to cover up specific minority targeting. For example, in Atlanta, English Avenue and Vine City are adjacent neighborhoods that form the Bluff. It's not too far away from the Mercedes-Benz Stadium, not too far from downtown Atlanta. The Bluff is what the tobacco industry would consider a focus community. Now, focus describes low SES communities with urban characteristics, predominantly communities of color. Focus residents are often at risk of poverty and have high economic insecurity. Many are unemployed or work poorly paid positions. They are often less educated, uninsured, and are medically underserved. They suffer disproportionately from tobacco-related morbidity and mortality. They have limited access to health care, cessation products, and or tobacco use prevention programs. You will not find medical facilities in many focus communities, no dentist offices, no banks, in many cases no sidewalks, no streetlights. Focus neighborhoods are often in shambles. Now, focus residents often have limited access to healthy food options. For example, in the Bluff, Giant Food, one of the only grocery stores in the community offering a range of produce and healthy items, closed in 2016. Many focus residents rely on public transportation. They ride the train, the bus, or walk everywhere they need to go. So if there's not a grocery store in their community, they have to rely on their local corner stores for all of their household needs. Now, there's a store in the Bluff with a huge prison-like fence around it. The retailer only allows a few customers inside at a time. One day, I waited 20 minutes to enter the store. I stood outside in the freezing cold with a little girl and her grandfather. And once we got inside that store, there was nothing but alcohol, mentholated cigarettes, flavored tobacco products, and blunt wraps placed just near candy, snacks, and little toys. And there were no healthy food options, no fresh produce. So listen, I've done retail assessments across this country. I've hit retail in just about every state, and I can tell you that there's a difference. There's a difference in marketing between different communities. And in focus markets, you'll just see the stores plastered with tobacco ads. Now, the Bluff, this community, was briefly featured in the film Big Tobacco, Young Targets. And in the film, there are two African-American teens that were interviewed at retail. they spoke about how they started smoking young due to stressful living conditions. And one teen said the Bluff was a rough and tough neighborhood where kids start smoking at very young ages. So if you guys haven't had the chance to view the film, it's definitely worth watching. And there's information on how to download and save the film in the Follow the Science fact sheet. But anyway, as the teens were being interviewed, you'll notice that there are several menthol tobacco ads in the background. Now, we know that the tobacco industry targets youth across the globe. You'll find youth smoking in just about every community. But if you've ever lived in, visited, driven through a focused market, then you know that there's a high density of tobacco retailers, and the stores are plastered primarily with tobacco ads. So just know the tobacco industry targets focused markets more aggressively than any other market in the United States. This is where they target the, quote, young black porn stupid, unquote. Again, R.J. Reynolds' words, not mine. Now, non-focus describes communities with mid to high SES, socioeconomic status, and suburban or rural characteristics. Now, non-focused residents often enjoy economic security, higher education, better insurance coverage, and better access to health care. But of course, this is going to vary by household. Now, as far as the tobacco environment is concerned, non-focused communities have a low density of stores. Philip Morris dominates tobacco marketing in non-focused stores, while R.J. Reynolds holds the number 2 position. Together, Philip Morris and R.J. Reynolds heavily market non-mentholated cigarettes like Marlboro, smokeless tobacco products, chew, dip, snuff, and electronic nicotine delivery devices. In focus markets, R.J. Reynolds and ITG dominate tobacco marketing with mentholated cigarettes that are potentially more hazardous than non-mentholated cigarettes, like and menthol cigarettes would include Kool and Newport. They heavily market little cigars and cigarillos, as well as electronic nicotine delivery devices. Now, non-focused stores tend to have less tobacco presence. You'll see fewer ads, fewer displays, less tobacco placement near candy, fruit, toys, and snacks. They receive fewer promotions and less discounting than focus markets. Now, of the $1 million the tobacco industry spends to market tobacco in the United States, most of it is spent in focus and focus-on-the-fringe markets. Now, Focus-on-the-Fringe is a community that just shares the characteristics of focus and non-focus community. It's a community that borders between a focus and non-focus community. The 1998 Master Settlement Agreement, MSA, and the 2009 Tobacco Control Act are laws that are meant to protect the public at the retail level. Now, the MSA prohibits the tobacco industry from developing products and advertising that target youth, including ads and product packaging with cartoon graphics. So Joe Camel and Coral the Penguin were meant to die with this law. The MSA severely restricts outdoor tobacco advertising, including large highway billboards, as well as tobacco ads in stadiums, arenas, shopping malls, and video game arcades. Now, it prohibits the paid promotion of tobacco in movies, but, we'll see tobacco use and tobacco ads in movies. This law just says the tobacco industry cannot offer payments to the motion picture industry to advertise tobacco. This law also bans gifts with packed purchase, among other things. Now, the MSA applies to products that contain tobacco. The next law, the 2009 Tobacco Control Act, gives the FDA the power to regulate the sale, manufacture, and distribution of all tobacco products, and that does include electronic nicotine delivery devices, vapes, e-cigs, which do not contain tobacco. Now, these two laws present an unprecedented opportunity to reduce disparities and tobacco-related health disparities in underserved communities. However, tobacco companies use increasingly sophisticated marketing techniques to circumvent laws that are meant to protect youth and the public. For example, in 2004, the 2004 Cool Mix campaign, which you can see an image of that on the slide, it was released in 2004. It was a blatant violation of the 1998 Master Settlement Agreement. Another example, shortly after the 2009 Tobacco Control Act banned candy and fruit-flavored cigarettes, e-cigs emerged with hundreds of delightful flavors. Another example, in 1970, President Nixon banned tobacco ads on television and radio, but now we see the tobacco industry advertising tobacco on the internet and social media. We see them advertising electronic nicotine delivery devices on the internet, social media, on television, radio, large highway billboards. They are sold and advertised in malls. Again, we have several laws that are meant to and have protected the public. However, the tobacco industry, being the powerful marketing geniuses that they are, have found loopholes in these laws. And those loopholes have set public health back a few decades. Now, TRL, or Tobacco Retail Licensing, allows loopholes to be closed in tobacco laws. It allows local communities to prioritize enforcement when state and local authorities are unable to do so. It can be used to limit youth access to tobacco, prevent illegal tobacco sales, and force retailers to abide to a high standard of conduct. It generates annual fees, which can be used to create programs that allow regular enforcement. TRL, as well as zoning, allow control over the location and overall density of tobacco retailers in a community, which can reduce predatory marketing in underserved communities. So it's important for those of us working in public health to take a comprehensive approach towards addressing retail. In addition to taking the policy-based approach when and where we can, we also have to conduct tobacco retail assessments, monitor tobacco control law compliance, build and sustain relationships with retailers, and provide ongoing tobacco prevention and education to retailers.
Thank you for all of this insightful information so far. Given that we really formatted this discussion around addressing some of the top levers that were identified in our public health workforce, I'm curious, one of the levers that was highlighted was around systems and strategic thinking, and I'm curious if you could describe for us some ways tobacco control programs can better monitor tobacco law compliance at retail.
Sure. Well, it's important to be aware of all of the local, state, and federal tobacco control laws that impact retail. What policies are in place regarding the 4 Ps? What is the age policy to purchase tobacco? What are the tobacco retail licensing and zoning laws in your state or community? How is compliance of all of these tobacco-related laws currently being monitored? For example, the Tobacco Control Act is enforced by the FDA. The MSA is enforced by state attorney generals. Both have systems in place for the public to report violations. However, there needs to be a system in place that includes frequent and ongoing store visits to monitor compliance of these laws. Now, state and federal laws, sometimes they're difficult to enforce at the local level. I can tell you that there are still, in 2019, some MSA violations out there, namely Oh Joe Camel and other ads with cartoon graphics are at retail in store windows. With that being said, there might not be anyone monitoring compliance in which there would be a need to put a plan in place to do so while ensuring all of the 4 Ps are being monitored. Now, I can tell you that right now as we sit on this phone call, there are over 4,000 big tobacco TMs at retail. They're influencing wholesalers to sell tobacco to retailers. They are influencing retailers to sell tobacco to customers. They're speaking directly with current and our potential tobacco users, and they are influencing tobacco use. So retail is clearly where the problem is. It's where the tobacco industry, in particular the big 3, it's where they do the most damage. And we know that everyone goes to retail, whether it just be for your prescription or to get groceries or gas, everyone goes to retail. So everyone's impacted by tobacco retail marketing. So it's important that public health professionals get out there too. And I'm not just talking about sending youth out to retail to count ads. Again, it's imperative to develop a system capable of comprehensively and repeatedly monitoring point-of-sale marketing practices and tobacco law compliance.
Thank you. Another theme that came out of our public health workforce was training that focused on building a vision for a healthy community. And in relation to the discussion we're having today, I'm wondering if you could speak to what partnership strategies tobacco programmatic staff could employ with retailers in order to address compliance.
Okay. Well, as I mentioned during the presentation, the tobacco industry has built and sustained relationships with retailers. I mean, it's dysfunctional, but it's still a relationship. What retailers don't realize is that the tobacco industry needs them just as much as retailers need ongoing tobacco discounting. So the tobacco industry needs retailers. They need them just as much as retailers need financial incentives to help discount tobacco. Without retailers, think about it, where would the tobacco industry be? How many people could they reach? I mean, in other words, retailers, they have more power than they think, and when they're able to realize it, they can flip the script and take back control of their tobacco category and still qualify for a contract with ongoing financial incentives. Now, when those of us working in public health begin working with or building relationships with retailers, we have to remember that retailers are human, and many don't like the tobacco industry or the hassle of selling tobacco, but it pays the bills. It puts their kids through college. Now, many retailers don't smoke. They don't want their children to smoke. But, you know, tobacco is legal. They have the right to sell tobacco. But retailers also have the right to sell tobacco in a manner that does not harm the public. So, you know, when those of us working in public health go out to retail, we can't demonize the tobacco industry and burn bridges with retailers when they can be our biggest allies. So prior to making your retail visits, you want to develop a plan. You want to develop a schedule for visiting targeted stores. You want to select appropriate hours and days of the week. You don't want to go to the store when the retailer is super busy, like on Friday. You want to assign 1 or 2 adult staff members to go out and build the relationship prior to conducting business in the store. And this relationship will take some time. You're not, in many cases, not going to build a relationship with a retailer during the first or second store visit. It might take you a couple of visits or a few visits. When you visit retail, dress accordingly. I mean, if you go into a store wearing your Sunday's best, you're more likely to intimidate the retailers as well as store patrons. I mean, the way you dress might cause customers to think you're a cop. They'll leave the store. If you're trying to bond with a retailer, the last thing you want to do is run away their business. So dress down. Jeans and a T-shirt, leave your work badges in the car, blend in, be safe. Your goal is just to go to the store and build a relationship. When you go into the store, you want to speak directly with the store's decision makers, not the clerk. You want to speak to the manager or the owner of that store. Develop talking points and or a script. Don't expect the retailers to hand over their tobacco contracts or allow you to take pictures of the tobacco category. Some might just allow you to do that, but just don't expect it. Don't go in the store saying, I'm with public health, I'm going to come in here and take these pictures. No, that's the best way you're going to get kicked out of the store. Plan on rejection. Now, some retailers simply won't speak with you until you've gained their trust. That's what building a relationship is all about. But I can tell you at retail, it might be a little challenging because some retailers might go as far as to claim that they don't speak English, or they'll, tell you they're not the owner or the manager of the store when they really are, just to get you out of the store as quickly as possible. Again, part of this is because of their fear of the tobacco industry. Now, some retailers will give you a fake name. As a matter of fact, most of my retailers in Detroit and Atlanta, I'd say that was probably about 600 retailers, told me their name was either Mike, Sam, or Ali. So there will be challenges working for retail. Just plan on rejection, plan on making multiple trips until you reach your desired goal. Now, if retailer incentives are in your budget, retailers love functional items like change mats, penny trays, ashtrays, or trash cans, and you can make the best of these items by making them durable and permanent with a simple tobacco prevention message like 1-800-QUIT-NOW. One thing to avoid is using color patterns that are similar to leading tobacco products, as it could trigger tobacco use. So don't make anything red and white like Marlboro or pink and black like Camel No. 9. Now, if it is not in your budget to offer the retailers any type of incentive for, working with them, then that's okay too. When I worked for Big Tobacco, retailers knew that I had a pocket full of cash to offer them. I had money everywhere. My left pocket, right pocket, front pocket, back pocket, left sock, right sock. I had so much money to offer to these retailers, but they didn't want it. They didn't want the money until I, again, formed a relationship with them. Okay, so it's not always about money and incentives. Now, after you do the hard work of building the relationship, then that's when you want to go in and conduct retailer surveys. Talk to the retailers. Get information about their tobacco use, cessation, and or quit history. Ask them, have they ever suffered from a smoking-related disease or know someone, perhaps a family member, who has suffered from a smoking-related disease or died from using tobacco? Ask them how they quit or if they need help quitting. You can ask them about some of the disadvantages of selling tobacco. I can tell you up front, two things they'll likely tell you is, one, tobacco ads make their store look cluttered, and two, they create safety hazards. So advertising on store windows and doors limit law enforcement visibility during community patrols, and advertising on counters and protective glass obstruct the view of the store floor, creating health hazards. Okay, so those are a few things that you might learn. Now, when you go into the store to provide retailer education, you want to provide facts, not opinions. Discuss tobacco laws. Advocate for the voluntary removal of ads, the reduction of product visibility. You might even have to offer assistance removing some of those tobacco ads. Some stores have large ContraVision window ads for the tobacco industry, and removal of these ads are extremely difficult and time-consuming. It can take up to 8 hours. So retailers might need a little help, but that's a way that you build that relationship with them. But the overall goal is to encourage positive changes at retail in order to protect the public. No matter what you do, stay persistent. Always leave a brochure or a fact sheet with the retailer so that they can read over it later and share it with other store decision makers and maybe even other retailers that they know. It's good to know that English might not be the retailer's primary language, so multiple language versions might be necessary.
Thank you for that. One of the other themes from our public health workforce survey that comes to mind was around change management. I'm wondering if you could share, how can tobacco control programs enhance their surveillance strategies to identify, monitor, and track some of these retail marketing components that you've mentioned in your overview in order to be better positioned to address and affect the retail environment?
Okay. Well, in my opinion, the most important thing that you guys can do is create comprehensive retail assessments that expose disparity in access to tobacco products in various communities, characterized by differences in demographics and socioeconomic status and health-related disparities. These assessments should include a store profile that identifies the store type, location, etc. For example, is the store focused or non-focused? After listening to this presentation, there's going to be a difference in marketing. Is it a chain or independent store? Is it contracted or non-contracted? The tobacco industry does the most damage in contracted stores. Is the store high volume or low volume? High volume stores are going to reach more tobacco users. They're going to draw in more people to use tobacco. Now, a comprehensive assessment should monitor the 4 Ps, all 4 Ps. For example, when monitoring presence and placement, which are your ads and displays, if you go to the store and just count the number of ads you see outside, that's not enough to expose disparity in access to tobacco. Instead, create an assessment that tracks the type, location, and quantity of exterior and interior signs and displays, including the dimensions of each display and the total number of visible pack facings. This is going to expose the differences in marketing in different stores, different communities. You also want to identify the tobacco control law violations regarding presence and placement. Okay, so now I understand this might seem daunting, and some of you might have been to retail and you realize all the challenges and just how difficult it is overall, but with practice, this can be done in a matter of minutes. And also working with community and faith-based leaders, as well as law enforcement officers that live, work, and shop in these communities. If you work with them, they can be extremely beneficial because they might already have a relationship with the retailers, and they can help you get your foot in the door. Like in my community, I know the retailers at Walgreens. I know the owner at Publix, at the grocery store, because I'm there. You know what I mean? So you might want to build relationships with people that work in the community that you're monitoring to help you get your foot in the door. The tobacco retail environment, again, I know can be challenging, but it's necessary that we get out there And if your organization needs additional training to enhance surveillance strategies, to be better positioned to address the retail environment, then Follow the Signs offers a 2 to 3 day comprehensive and interactive tobacco point of sale crash course. And this training encourages positive changes at the retail level. It provides simple methods to identify contracted retailers and the most aggressive tobacco companies in your communities. It teaches quick methods to calculate tobacco display dimensions without going behind the counter or pulling out measuring tape. Now, in most cases, retailers won't allow you behind the counter anyway, so you have to learn how to measure and get the dimensions of these displays without going behind the counter. Another thing, the training provides tips on how to build relationships with retailers, as well as how to provide education in a manner that speaks the retailer's language. For example, in public health, our goal it might be to encourage the voluntary reduction of display visibility. Okay, we know that if people walk into a store and they don't see tobacco packs right there in their line of sight, they might not decide to make the decision to purchase tobacco today. How do we translate that to a retailer? Well, instead of saying, hey, can you remove your tobacco displays, one thing we can say is, hey, retailer, hey, Sam, did you know that you can reduce tobacco theft by placing doors on your tobacco displays and are storing all of your tobacco in the most convenient location in your store, which is the overhead bin above the point of sale? You can also say, hey, Sam, did you know that you can increase the shelf life of tobacco products if you avoid storing tobacco products in direct sunlight here behind the counter? How about you put them up in the overhead bin? Okay. Now, the tobacco industry does not return stale and infested tobacco products. Whatever retailers buy, they are responsible for selling, and in many cases, retailers can't sell the tobacco products that the tobacco industry requires them to bring into a store. That's one of their complaints. So, again, there's ways you can achieve your goal, but you need to probably speak the retailer's language, okay? Now, the training provides all of the information needed to conduct comprehensive retail assessments. You can see page 2 of the Follow the Signs fact sheet for additional details, and also remember to complete the Follow the Signs evaluation form for a discount on our services. And this concludes my presentation. So if you need me in the future, I'm only a call or an email away.
Thank you so much for such a robust, quick overview of so much rich information. We got a few questions in our chat box, and I'll try to get to all of them before we wrap up today. One is related to a film that you mentioned during your presentation. Could you share the name of that film for the audience?
Sure. The film is titled Big Tobacco, Young Targets, and when you click on the Follow the Signs fact sheet link, I believe there's a lot of details on page 3 of that, including if you go to the very bottom, you'll see how to download and save that film.
Great. And those fact sheet materials, again, for everyone participating today and for all those that registered, that will go out in a post-webinar email, so you all will have quick access to that. Another question we received, what policy options are available to states and localities who want to reduce point-of-sale advertising by disrupting how the tobacco companies work with retailers? So you spoke to this a little bit, but is there anything else you could say about that?
Well, I would just definitely use tobacco retail licensing and zoning. You can basically hit all 4 Ps with that: product and packaging policies. There's presence policies for the ads and displays. There's product placement policies. There's also price and promotion policies. So, over the next 2 sessions, I'm going to go more into detail about the policies that you can use for all of the 4 Ps. But if you can get tobacco retail licensing and zoning, that's going to help you fill the loopholes that are in the tobacco industry has found in that Master Settlement Agreement and Tobacco Control Act.
Great plug. Yes, there is more for those of you that are joining us today, and we'll have information about the next session here in a moment. Another question we received, in your expertise and experience, can point-of-sale marketing be accurately described as a health, equity, and social justice issue?
Yes, absolutely.
Yeah.
Yeah, it's just yes. The answer is flat out yes.
Yes. Let's see. We have a question here. Based on your opinion and expertise of tobacco assurances of voluntary compliance, do you believe that the incorporation of assurances of voluntary compliance can be used as a stepping stone for government-initiated policy changes like local tobacco retail license?
Yes, I do. The one catch with the voluntary tobacco marketing is, or the voluntary removal of tobacco marketing is that, like I mentioned, the tobacco industry, they go into these stores frequently. They're in contracted stores once per month. If that store is a high volume store, which I'll discuss during the next session, then the tobacco manager will probably be in there every 2 weeks. Every time you go into, let's say you go into a store, get the retailer to remove some signs, every time the tobacco manager goes back to their store, there's a chance they might put up more ads. So it'd just be important to one, influence the retailer to remove the tobacco ads, but also monitor it. So if they removed any ads, if they put up any signs like 1-800-QUIT NOW signs, you need to go back and monitor that, and then document how the removal of tobacco ads has worked in your communities.
Thank you. And one more time, can you name the name of the film that you mentioned earlier?
Sure thing. It is called Big Tobacco, Young Targets. And you'll see that again in the Follow the Signs fact sheet, which you have a link to.
Great.
Or they'll receive a link to it after the email. After the presentation, right? Okay.
Yes. And then one individual is asking if you already have some Follow the Signs training scheduled at any sort of national events or things that folks can register to attend. They remember this being offered in some other settings and are wondering if you have those or if any of those dates might be posted on your website.
We don't have any events that are scheduled for the public to attend, or most of these are private events, so nothing's scheduled right now. But whoever asked me that, send me an email, and I will forward you information if something comes along that you can attend.
Sounds good. A few more questions. What are some of the incentives that you mentioned earlier, if you can repeat some of the incentives again for retailers? And I'm assuming that's for us to engage with the retailers. So
you want to know what are the incentives the retailers receive when they're contracted with the tobacco industry?
So the question did not designate if it was from the tobacco industry or when you spoke about the incentives that maybe we could extend as public health professionals in order to encourage that relationship. So maybe speak to a little bit of both of those.
Okay. Well, the financial benefits that the retailers receive include ongoing financial incentives. That means ongoing discounting and price protection. Whenever there's a tax increase, the tobacco industry will increase discounting on certain brands so the price won't go up, which I'll discuss on the third session on, I believe that's March 26th. They receive free advertising. So it's strictly based on advertising and discounting. Those huge tobacco displays you see behind the counter, all the large tobacco signs, all of those belong or are given to the retailers by the tobacco industry. As far as what you guys can do to offer incentives to the retailers is basically if you can copycat what the tobacco industry is doing with change mats. Just go into a store and look at the tobacco as the functional advertising pieces. Change mats, ashtrays, those ash trash cans outside, trash cans. If you can offer them even pins or penny trays, then they won't throw those things away. They'll keep them and make them permanent and durable, because if you think about the retail level, you got people going in and out of these stores all day long. Things get moved around. Whatever you give them, you want the public to see. Okay, so make it durable and make it a permanent piece, not made of paper.
Great. Well, that concludes all of the questions. We did get one final one that I will just address in our conclusion remarks, asking about the availability of this information. We developed this virtual series really to elevate some of the themes that were highlighted in our public health workforce and interest needs and survey that we do for programmatic staff and leaders across public health agencies. And as a result of that, we wanted to draw a link to a specific topic, and knowing how important it is for tobacco program managers and their staff to really understand these concepts related to tobacco retail marketing, we decided to lift those things up in a 3-part series. And so each of these will be, the recordings will be available to folks, and we are really encouraging people to utilize these recordings as a way to engage staff, post some internal staff training around them, and have some conversations and utilize the information here to strategize as you move forward to address tobacco control issues in your own communities. Thank you all so much for joining us today, and thank you to LaTanisha for joining us and speaking to these important issues. We will be looking forward to having everyone join us on the second installment that's on March 20th that begins at 3 p.m. Eastern. The registration link is there on the screen as well as in the chat box, and will also be included in the post-webinar email to everyone. Thank you all for joining us, and we'll look forward to having you next week.